So there's a lot of myths out there about pelvic floor health, and it really frustrates me because I see people wandering around with wrong information in their heads, not knowing where to go to get better information, and then that makes it really hard for them to actually help themselves or fix their problems. So I want to go through 3 myths and let's talk about them. And if you have any comments or questions, please add in the comment section and I will get back to you as quickly as possible. Myth number 1, it is normal to leak for the rest of your lives after you've had babies, to be incontinent or not be in complete control of your bladder, sometimes bowel. That is not true. It's only normal for, up to about 6 weeks, sometimes longer if it was a more problematic delivery and there's more issues involved, but it should not be like that forever. It is very common though. And so there's a big difference between common and normal. So it's not normal. So please get that out of your heads right away. If somebody tells you, oh yeah, it's just normal, no problem, it's not. It's just super, super common. And so if it's that common, there's got to be reasons why, but the beauty of it is that to help somebody strengthen their pelvic floor muscles can be really, really simple. And instead what oftentimes happens is women just, for various reasons, aren't able to get that help. And so they eventually have more struggles with the bladder control. They may stop doing what they like to do. They might not want to run anymore if they were a runner. Going on the trampoline with their kids might not be an option anymore. And every time picking up baby or laughing and sneezing, if there's an issue there, that's not great. You don't want to have to wear a pad as you're exercising or even just leaving the house going out for the day. So that's a really big myth. That information has been out there for so long that it's normal. Please, it's not. So what you can do is go see your pelvic floor physiotherapist. In British Columbia, we have a website, bcphysio.org, and that will allow you to search for a physio, a pelvic floor physio, specifically in the area you live in. I'm sure every other province, country, state, everywhere would have something similar. And so if you're not too sure where to find that person, phone the nearest university, Google, phone your nearest physio clinic and tell them who you're searching for and they can help you. So myth number 1 needs to be the information needs to be out there. Please share with your friends. I sometimes wonder why is that information still out there and why are so many people, even younger women, not searching out help? Why they're thinking this is normal. So I've asked lots of my clients and kind of compiled a few reasons. One I found is that oftentimes somebody's having those issues that they're leaking and they've had a baby or more, and then they talk with their friends finally and their friends say, oh yeah, I have the same problem, but that's kind of confirmed to them then, oh yeah, okay, everybody has this problem and that's just the way it is, but it's not. So that's really probably one reason why people don't seek out help. They're getting that message confirmed again that it's normal. Commercials. If I see one more pad commercial, I'm going to explode. And now they have insertable things as well to help. Now, yes, that can be super helpful while you're, to keep going and doing the things you want to do, and while you're learning how to strengthen your pelvic floor muscles. But I don't like to see it as a fixing thing. Like that's it, you just wear a pad and that's that. And now in the commercials, they have really younger, fit-looking, sporty people advertising that. So they're again reinforcing that message that this is what you should do. You have babies and now you put the pad on and that's it. So those commercials are more and more and more, and I don't like it when I see them because it's giving again women the wrong message. Another reason I think is that leaking is not painful, and so pain is a great motivator to have somebody seek out help. If it's not painful, people don't tend to go for any help. So, or they're less inclined to go for the help. And so that's definitely, thankfully it's not painful, but unfortunately it can keep people from searching out help. So another reason, I think an obvious one, is sometimes it's a bit embarrassing. People feel ashamed. They don't really know maybe other people are having that issue. So they think, well, maybe I should go talk to my doctor. And that would be a great first step as well. Oftentimes people don't, though. In fact, I think stats show that 80% of the time, if somebody does talk to their doctor, it's not the doctor asking them about those issues, it's them bringing it up. But it doesn't happen very often because our GPs, our family doctors, they have very little time. They're so overworked, they've got massive amount of patients to tend to. And then you come in with this really sensitive issue that you're feeling, not so good about. Sometimes that isn't the most comfortable atmosphere to bring that conversation into. So there's definitely a few thoughts on why people might not be searching out help. And it's pelvic floor physios everywhere are constantly trying to get the message out there via writing articles, doing these little YouTube videos, sending out information, doing talks. The more we can get that information out there, that there is another option and a conservative option, we'll just keep working towards that so people get that message. That's myth number 1. That is not normal. Please seek out help. Myth number 2, as we get older, we're just going to lose control of our bladder and our bowels. That is also not necessarily true. Again, it's very common. And so sometimes when things become so common, it just gets labeled as normal, and that's what you're supposed to expect. Well, I'm over 60, I'm over 70, and now I leak, so that's just the way it is. But once again, that's not really the way it has to be. I treat people anywhere from 20 to 90 years of age, trying to help strengthen their pelvic floor muscles. And of course, we're not talking about pathologies, so things like any neurological issues, dementia, Parkinson's, sometimes MS, sometimes. That is another factor in there, but if we just think about, say, the average healthy adult, no, they shouldn't be losing control of their bladder and bowels as they become older. And there's not enough research on all that, but they are looking at trying to help strengthen people's pelvic floors well before they get to that age, or an older adult, so that they will be more in control. So again, it's probably just because the pelvic floor has never really been thought about, tended to. Maybe there was leaking before and now it's just becoming more pronounced. Or if there hasn't been any leaking and it's just starting as somebody's getting older, again, it could just be weakening of the muscles. So there's always, different ways to think about things, and just please don't be okay with leaking. Really try to seek out some help first, conservatively. If you have to go another route, if medication is indicated, wearing something, and or an eventual surgery, I'm certainly supportive of all that, but please try your conservative exercises out first, because it's such an easy fix sometimes, and people get results really quickly when they do the work. Another myth is about KEGELS. The myth is KEGELS are always the answer, and they aren't. They're a great answer, and that's what I'm working with a lot with my clients, is helping them strengthen their pelvic floor muscles, and that's what we kind of think of as a Kegel. But it's not always the answer. When it isn't the best answer is when the pelvic floor muscles are tight. They're too tight. There's too much tone in there. And if we think about pelvic floor muscles as basically any other part of the body, we would never use a strategy right off the bat strengthening tight muscles. So think about the pelvic floor muscles more like any other muscle in the body. If you had super tight hip flexors, which is really common as we all know, they may be a little weak too, but you wouldn't start strengthening them right off the bat because they're too tight and they need a little bit of length in them before they can become strong. Pelvic floor muscles are no different. They need flexibility enough to allow you to move. They need stability enough to keep you solid and support you, and they need strength enough in order to accomplish all the many functions that they participate in. So if somebody, how does somebody know if their muscles are tight? Sometimes they don't. Most often they don't. If somebody has pain during intercourse, then that might be a signal. There's definitely some soreness in there, so there's some trigger points. Probably that would be a big clue. And that can be helped as well with some release work. It would be a different approach. Now those muscles could still be weak, so they can be weak and tight, but you really need to address the tight component first, and then work into the weakness. It's like if I had, so my bicep here, if I was, full length is here. I'm contracting and I'm lengthening. Now what if I am stuck here and I'm just contracting here? Might really even seem like a really great strong contraction, but I don't get that full length. I'm not going to have the full use of my arm. Pelvic floor muscles would be the same. If they're super tight, they might contract really strongly, or what feels like a strong contraction, but it's actually not. They just don't have the length to expand and then come into a contraction. And oftentimes with tight pelvic floor muscles, the incontinence isn't so much of a stress incontinence like we were talking about, where you might sneeze, laugh, cough, lift baby, go for a run, and leak. It's more of an urge incontinence. So the muscles are so tight, they're on when they shouldn't be, and they just give different messages to the brain, the messages we don't want. And people that have those sorts of issues with that type of incontinence might be going constantly throughout the day, several more times than what would be considered a normal amount of going to the bathroom throughout the day. So if you're unsure, please, 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 please check in with your pelvic floor physiotherapist. When I see people here, I assess them. It is an internal exam, but it's much more comfortable than when you think about your PAPs and things. There's no instruments involved. It's a comfortable atmosphere. It's a two-way relationship, and I can get a good idea of strength, endurance, quality of contraction, where they're contracting from, trigger points. We can cover a lot, find out what cues somebody responds to best, and then give them whatever the exercise program is for them to work on. So there's lots of help. So please share with your friends. Get the information out there as much as you possibly can. Friends, family members. There is another way. You don't have to stay wearing pads for the rest of your life. And also keep in mind that if the problem is small, because sometimes I'll have people say to me, well, I do leak, but it's like maybe a couple times a month when I have like a really big laugh and maybe I had a really full bladder. But think about it like other issues in the body, and that's sometimes a small problem, and most often the pattern is it becomes a bigger problem. We don't want that. We don't want any problem at all. So let's address it as a little problem. So seek out the help, share the message with your friends and family members, and seek out the help in whatever area you live in, because it will be so beneficial and you will be so much happier and not have to worry about that anymore. If you have any questions and comments, like I was saying earlier, please list them and I will respond and help you in any way I can. And thanks for listening, and I'll see you in the next video.